Oh, for grace to trust Him more. Oh, how sweet to trust in Jesus, just to trust His cleansing blood, just in simple faith to plunge me 'neath the healing, cleansing flood. Jesus, Jesus, how I trust Him, how I've proved Him more and more. Jesus, Jesus, precious Jesus, oh, for grace to trust Him more. Yes, 'tis sweet to trust in Jesus, just from sin and self to cease, just from Jesus simply taking life and rest and joy and peace. Jesus, Jesus, how I trust Him, how I've proved Him more and more. Jesus, Jesus, precious Jesus, oh, for grace to trust Him more. I'm so glad I learned to trust Him, precious Jesus, Savior, friend, and I know that He is with me, will be with me to the end. Jesus, Jesus, how I trust Him, how I've proved deepens and tempests are wild. Still I can trust him, I know he will keep me. He has redeemed me, and I am his child. Under his wings, who from his love can sever? Under his wings, my soul shall abide, safely abide forever. Under his wings, what a refuge in sorrow, how the heart yearningly turns to his rest. Often when earth has no balm for my healing, there I find comfort, and there I am blessed. Under his wings, who from his love can sever? Under his wings, my soul shall abide, safely abide forever.
You've argued in the group chat, whispered your opinions over drinks, and thought, I wish we could talk about this properly. Welcome to the Debate House. Hi, I'm Benedicta Frances, Executive Director and Research Consultant for the Debate House. It is Africa's leading discourse lounge, forum cafe, and symposium. The Debate House is a premier destination for vibrant debates and unforgettable experiences. This isn't just about debate. This is about building a community of thinkers, doers, dreamers, people like you who want to have bold conversations and actually grow from them. Now, every week, we tackle real issues that matter, from personal stories of hope, tragedy, and victory to hot-button political topics, both partisan and non-partisan. Nothing is off limits. We have topics like polygamy. Is it a violation of modern human rights? Or is it a preservation of our cultural identity? Should every adult be legally required to have a will? And even health topics like lupus was often misunderstood. Now catch this, we are doing all of this over food, drinks, and energy that hits differently. It's honest, it's respectful, it's real, and you won't just be hearing from anyone. We are building an editorial board of brilliant minds to help shape and guide these conversations. We are proud to have the likes of Very Reverend Father Akese, Atukwamina Daze, a seasoned journalist. We have Emefa Apao, who is a media professional. We have Abigail Jimal, who is a governance and anti-corruption advisor. Nanadjo Ampofo, a chartered mineral processing engineer. We have Dr. Emanuela Abwako, a pediatric oncologist. Now, we have all these people and many more who are passionate about creating meaningful discourse that pushes culture forward. But here's the truth. You will enjoy these conversations even more if you bring people like you, your friend, your partner, your crew. Trust me, the vibe is better when the room is full of familiar minds and new ideas. So here's a cue. Sign up via the link in our bio or our website at debatehouse.club and be part of something meaningful. Be part of a tribe of bold minds who don't just talk. They listen, they grow, and they show up. This is the Debate House. Engage, discuss, discover. You've argued in the group chat, whispered your opinions over drinks, and thought, I wish we could talk about this properly. Welcome to the Debate House. Hi, I'm Benedicta Frances, Executive Director and Research Consultant for the Debate House. It is Africa's leading discourse lounge, forum cafe, and symposium. The Debate House is the premier destination for vibrant debates and unforgettable experiences. This isn't just about debate. This is about building a community of thinkers, doers, dreamers, people like you who want to have bold conversations and actually grow from them. Now, every week, we tackle real issues that matter, from personal stories of hope, tragedy, and victory, to hot-button political topics, both partisan and non-partisan. Nothing is off limits. We have topics like polygamy. Is it a violation of modern human rights? Or is it a preservation of our cultural identity? Should every adult be legally required to have a will? And even health topics like lupus was often misunderstood. Now catch this, we are doing all of this over food.
whiter than snow, whiter than snow, yes, whiter than snow. Now wash me and I shall be whiter than snow. Now wash me and I shall be whiter than snow. Come, thou fount of every blessing, tune my heart to sing thy grace. Streams of mercy never ceasing, call for songs of loudest praise. Teach me some melodious sonnet, sung by flaming tongues above. Praise the mount I'm fixed upon it, mount of God's redeeming love. Here I find my greatest treasure, hither by thy help I've come, and I hope by thy good pleasure safely to arrive at home. Jesus sought me when a stranger, wandering from the fold of God, he to rescue me from danger bought me with his precious blood. Oh, to grace, how great a debtor dearly I'm constrained to be. Let thy goodness like a fetter bind my wandering heart to thee. Prone to wander, Lord, I feel it, prone to leave the God I love. Here's my heart, oh, take and seal it for thy cause Here's my heart, oh, take and seal it for thy courts above. Sing them over again to me, wonderful words of life. Let me more of their beauty sing wonderful words of life. Words of life and beauty, teach me faith and duty. Beautiful words, wonderful words, wonderful words of life. Beautiful words, wonderful words, wonderful words of life. Christ the Blessed One gives to all wonderful words of life. Sinners to the loving call, wonderful words of life. Also freely given, wooing us to heaven. Beautiful words, wonderful words, wonderful words of life. Beautiful words, wonderful words, wonderful words of life.
Sweetly echo the gospel call, wonderful words of life. Offer pardon and peace to all, wonderful words of life.
Jesus, only Savior, sanctified forever. Beautiful words, wonderful words, wonderful words of life. Beautiful words, wonderful words, wonderful words of
Sing more again to me, wonderful words of life. Let me move at beauty see, wonderful words of life.
words of life and beauty, teach me faith and duty. Beautiful words, wonderful words, wonderful words of life. 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 Sing the wondrous love of Jesus. Sing His mercy and His grace. In the mansions bright and blessed, He'll prepare for us a place. When we all get to heaven, what a day of rejoicing that will be. When we all see Jesus, we'll sing and shout the victory. While we walk the pilgrim pathway, clouds will overspread the sky. But when traveling days are over, not a shadow, not a sign. When we all get to heaven, what a day of rejoicing that will be. When we all see Jesus, we'll sing and shout the victory. the streets of gold. When we all get to heaven, what a day of rejoicing that will be. When we all see Jesus, we'll sing and shout the victory. When we all get to heaven, what a day of rejoicing that will be. When we all see Jesus, we'll sing and shout.
Sorry. Okay. Okay, so first of all, I think I should thank you all for your patience once again, and I think we're ready to begin the program. So, um, just make sure that all of us, our phones are at least on vibrate or silence, and then so we can have a nice conversation without feedback. Yeah. All right. Good evening and welcome to the Debate House. I'm Nia Krofi Smartabe. I'm an executive producer here at the Debate House. Tonight, in partnership with Quality Insurance Company Limited, or QIC Insurance, we're holding the second of our three-part discussion on cervical cancer. As many of you may be aware, January was Cervical Cancer Awareness Month. It's a month set aside as part of a global initiative aimed at reducing the spread of cervical cancer, which is the fourth most common cancer in women globally. In Ghana, it is the second most common after breast cancer. At our first session, an expert roundtable discussion 2 weeks ago, we looked at the question, if screening for cervical cancer is cheaper than treatment, why do health systems wait? A number of things stood out for me from that session. One of them is that while screening for cervical cancer is the best way for early detection, many women in Ghana, according to some studies, do not undergo screening. There are also other reasons. Part of it has to do with the cost of screening, which is one thing that came up at our last session, which I must say is also a better way, even though the screening might be expensive to some degree for some, it is much cheaper, we would agree, than treating the cancer after it's been diagnosed. And the other is the perception or feelings some women have about the screening procedure. Tonight, however, we are moving the discussion a step further. For too long, cervical cancer has been considered a woman's disease. But the reality is that the men are the carriers of the virus that causes cervical cancer. But how many men know about cervical cancer or the fact that they contribute to its spread? Some studies suggest most men have little or no knowledge about cervical cancer or how it spreads. So tonight we ask, should men be held accountable in the fight against cervical cancer? This discussion is not to apportion blame, but to explore why men, as carriers of the HPV virus, are not actively involved in the fight against cervical cancer, and how to get them to become allies or advocates in the fight against this disease. After all, if it takes two for this cancer to spread, then you'd agree with me that having a conversation involving the men is highly necessary. Secondly, we at the Debate House are considering setting up a fund to support the screening for cervical cancer. So before we wrap up tonight, we'll explore how best to get this fund up and running. And I also hope we leave you encouraged to pursue a preventive approach to this disease, which is the most preventable of all cancers, yet claims one too many lives in a year. Joining us for the discussion tonight, we have Dr. Mrs. Nita Asamoah Menu Jima, a specialist obstetrician gynecologist at the Kolebu Teaching Hospital. And to some faces, especially those of you watching us online, she may be familiar because she hosts the Facebook series Time with Dr. Nita. Thank you so much for joining us. Also with us at the far end of the table of our panel is Dr. Vanessa Aseye Atikui, a medical officer at the West African Rescue Association. She is also an icon for QIC Insurance's Go Girl policy. Dr. Aseye, thank you so much for joining us tonight.
Thank you for having me.
Welcome. And also we are joined by Madam Mavis Enima in the middle there. She is a cervical cancer survivor whose cancer was diagnosed 5 years ago. And Madam Mavis speaks primarily Chi, so we will switch back and forth between English and Chi, especially when we have to ask her questions. Akwaba.
Yeah, Medi.
And QIC's Go Girl insurance policy is specifically designed for women, and you can enjoy benefits which include the provision of a free courtesy car at the time of claim, one-time car servicing, and the facilitation of the 2-year mandatory driver's license renewal at the DVLA Prestige Center. So I think it's a good idea for all the ladies here. If you're already not a part of the QIC Go Girl policy, probably you should look into that as well. And QIC has other insurance products, including motor, general accident, travel, home, aviation, and marine insurance as well. And for those of you watching online and for those here, if you're already not part of the Debate House family, there's a QR code that you can scan. If you're in here, it's right there to my left on the wall. It will be projected on the screen as well. And those at home, you could scan as well and get updates, reminders, and notices from us whenever we have events coming up. So now let's get into the conversation. And Dr. Nita, I'll start with you. I remember last time when you were with us for the expert panel, there was one question, a couple questions that came about cervical cancer. So maybe if you could just do a reminder, tell us what it is and how it spreads and all that.
Okay, so I'll begin by talking about the cervix, what the cervix is. Every woman, every woman has a uterus. Most women have uterus, like a few people may not have, but generally every normal woman has a uterus, and it has certain parts. We have the body, then we have the sides, and then we have the, should I say the beginning or the first part of the uterus, and that is the cervix. So the cervix connects the uterus to the vagina, and because it's the part that is outside most, it may be prone to certain infections.
Okay.
So generally speaking, we would say that the cervix is the beginning of the womb, and then cervical cancer is a cancer that affects that part of the uterus, or cervical cancer is a cancer that affects the cervix.
Okay.
It is spread by a virus called human papilloma virus, which is the HPV virus. There are certain subtypes of the human papilloma virus. There are lots of subtypes.
Okay.
But the ones that are most notorious for causing the HPV is the 16, subtype 16, and then subtype 18.
Okay. And maybe you could continue with how it spreads, or Dr. Aseye could take it up if, yeah.
Well, thank you very much. So, like you rightly said, mostly the men are the carriers of the HPV virus. And just like Dr. Nita also mentioned, there are various types of the HPV virus, and the most notorious ones are the two that she mentioned. So HPV virus is basically spread through sexual contact. So skin-to-skin contact, we have to be very specific in that regard so that it's not assumed that it's just penetrative sex that causes cervical cancer. So skin-to-skin contact encourages or predisposes a person to the HPV virus. So it could be anal sex, it could be basically touching the area that can also cause the spread of the HPV virus. So skin to skin contact causes the spread of the HPV virus.
Okay. And Dr. Nita, I come back to you. One thing that has been stressed, especially at our last session, was screening and early detection. Why does early detection matter?
Okay, so I would speak first about the screening. What happens is that cervical cancer starts in stages. It doesn't just start and then you get the cancer. Just like any normal infection with your body, the human body has protective cells that fight against diseases. We have natural killer cells, we have T helper cells, we have CD4 cells. They are the body's immune system to fight all other diseases. Just as you can get a common cold, you can get malaria. Cervical cancer also starts like that. So initially, when you get the infection, the body tries to fight it. But with time, because viruses are difficult to eradicate, or should I say to kill, because they mostly survive in a host. They keep on adapting to new environments, new treatments. So it's generally difficult to get rid of them. So what happens is that over time, it can take as long as 5 years, 8 years, 10 years. It begins to cause changes in that area. So let's say we have HPV virus, several types. The other types cause other types of cancer. But the HPV 16 and 18 specifically cause the cervical cancer. So as it changes the cell structure of the cervix, the cervix is made of cells.
Yeah.
So as it keeps on changing that, then the cells begin to, in layman's terms, multiply without control. So the initial stage, screening is important because there's a pre-cancerous lesion before the main cancer occurs.
Okay.
So when you have a pre-cancer or pre-cancerous lesion, those ones can be taken off, or should I say they can be removed. The precancerous lesions hasn't gotten to a certain part of the cell where it cannot be treated. So there are several treatment methods or cure, should I put it in that sense, there's a cure for the precancerous lesions. So what happens is that when we have the screening and we realize that what you have is a precancerous lesion, we can take out either that part of the cervix that has a precancer and then leave the other portions, especially if the woman still has fertility wishes.
Yeah.
So you see a precancerous lesion in, let's say, a 27-year-old or a 30 or a 35. She hasn't started her family or she hasn't completed her family. You can remove that and then encourage her to complete her family subsequently with checkups. If the womb needs to be removed, it can be removed. But there are other stages also. We have stage 1, 2, 3, 4. When it gets to a certain stage, you cannot do anything about it. You essentially have to do other forms, radiotherapy and all that. So the screening is important because when we screen and we see the initial stage of the disease or the precancerous lesion, we can do something about it. We can treat or sometimes even cure it. That's why we advise early detection so we can do something. You don't have to come at a stage 3 or a stage 4 where essentially there is nothing we can do. And because it's so asymptomatic, most of the women, by the time they realize that they have symptoms, they've already crossed, say, late stage 2 or stage 3 or stage 4. That is when the abnormal discharge or offensive discharge starts. They start bleeding irregularly, and then maybe they have other symptoms, but by then it may be too late. So we encourage screening. If you screen, you are screen negative. Now we are doing vaccination for younger children so that it helps to protect against the subtypes that cause cervical cancer. So that's why we advise for the early detection.
Okay, thank you very much, Dr. Nita. And maybe Dr. Say, I'll come to you before I come to Madam Mavis to talk about the information or education bit of it, because a couple of the researchers I read, whilst men mostly came up and being mentioned as not knowing about it or knowing very little about it, I was surprised to see that the women also didn't know much about the importance or screening. Not that they didn't know about it, but they didn't know about the importance of it. Why is that so?
The education bit is mostly the part to blame for why a lot of the individuals seem to be ignorant about cervical cancer and screening as well as prevention. When it comes to the men aspect, majority of the time, for a public health standpoint, the education has mostly been focused on the women simply because they are the one that's developed the disease. But at the end of the day, we're leaning more towards prevention, which involves both the men and the women. And the goal is to be able to empower the men such that they understand that it's a collective effort to help prevent the disease, especially in their women. So screening education is highly important. I mean, having sessions such as these go a long way to educate the public on what cervical cancer is. Yes, cervical cancer is the most preventable cancer around, but then it's still killing women simply because education is poor. And most of the women that may be walking around with potential cervical cancer have no symptoms. That is, they're asymptomatic. And it takes about 10 to 20 years before even the symptoms start to show. And just as Dr. Nita rightly mentioned, once you start showing symptoms of cervical cancer, it's already too late. And so we're putting in a lot more effort into screening, education, and vaccination. I think recently the government has started rolling out vaccination for the teenagers, the young girls, because the best and safest way to prevent HPV or cervical cancer is through vaccination. So we have to vaccinate, we have to educate. Education helps us to understand the disease progression. It helps us to feel empowered. It helps us to know what to do, what to look out for, and how to provide support for individuals that may be diagnosed with the disease.
Okay. Ma Mavis, my member of Hokaka, Oko Hospital, a ban is said, Yakasa Winya cancer no, Uncomono Muni Udi, no, Omubisa, I can say, Wonkeni, Honso Apomo, Asem, and I say Wonkwa Wapum in some common. Essentially, I'm trying to find out from her if, forgive my chi, I'm sorry. I'm trying to find out from her if, because we the men are carriers, I wanted to know whether, the conversation solely focused on her and her health, or if there were questions also about her partner's health. Yeah.
Medase, say, omu bisame. Me ana minim de na ekoso, nti me call say me koye test. Nti me call ye no na omo hwe me ye bibia wie no. Na omo kire me say omo de call baby fufro nti nyame ye adom na eba me ba beje me beje a na omo hu say eye no bia ana den a. Nti meje ye na me wie na me call ye no. Eba ye na me call ye no omo start na me tana ase. No bisa me say test no mo ye na eba ye no e kire say e cancer ni bia na me kunu wo ho na me so waka baabi no bisa me say mfie sen ni mbisa me nsem bebre mbisa me bia na mayi ano no mo say na yare a wanya no enti sisi e be ne den na me so me de na mo say baabi adu no ano odin o mu ni ehu ayi bia o mbeye the baby adu ni de adu de say na I say moja tu me kwachiri pa me so na me nim say eye bibisa akra ti achiri a me koje results na ba ye no na o mo na me kasa ya enti oya so se me kuna wudi a ene ka onwu ye de anko mo nim say de o me no wa wi de o mbu say me taama de na ye me a na me so eye me ne ade no me nim say eye bibisa ebisa ya me ache na me nim say eye bibisa na e koso nti bra me hu say mogatuo na dɔɔso no na fe me ye say ne metu ho anamo na omo kire omo de me fa nkyekire bebre mu na me de baaye ti me de baaye no omo ye say na sa ade a omo bɛboa me omo bisa me say me na me say me ni ska enya ade a sa ba bi omo kye me say me nkwa menya say ska no so menya nti Madam Rose ne sister Abigail omo ye nurse so baby a me koye we wo kwalebu na omo kire me say no mbeboa me na nyame adom omo boa me na me de baby a na adu na no odin pa you say ase ensuo begu mi gyae ansa na mogya ne nso eba nti no omo kire me say ay honko a e na omo de mbekọ a ombe ya ama me
Nenti o started treatment no treatment ben sa mo na o na o fa
I'm started treatment no omo de me call chemo nti me call doctor no ho no so nya so oje ya na ebe dimre bi kakra ansa nti na efe na ade na ha me call anim na ye call a ase enipa ne dawson nti nurse no na me ka kire no say de ekọ so ni no so saa de a na ememra na ono anko hu obi si ekohu obi na ye ka ohaw ni nyina na saa de no ekọ so a de na du akire dada to opo ma chew to ne ohu pan bi na one ne kasa ye na o say nye ono a enipa ne dawson nti no onya botere o mbehwe me na o say de na ha me oni me gina ha ekura anya agro kura ha me pa nti eja ye koye na omo de me call hu doctor panyin no ne me kasa ya afanchi chirim chire me de me start de me hunu de be koso nti me hu sa na mani nyina ma me mpa aba me mfa ne edin na me nyere me ho o kan na me se mate ti omo ye call kimo no e no omo koye de so omo ye bia no omo start pan omo wo me a no me chem se me call afidie so akoda afidie so na me start afidie nso na me kokimu na me ko afidie so the doctor ne be kire me se me nye bia no nyame anim nie me mia me ho ye bi se bi nya me da na me treat bibi sa nso da nti de obe kire me se me nye ne no na me hwe so na me ye e wo start de a ene ensem bebre wom nso aye se malaria enya ona wo ye den wo no maduro wo mfa ne easy se wo no maduro na na wo ho atọ wo mfa ne easy ubehu niema bebre sa pepepe nete sa pepepe nete enti no doctor no ye kasa bebre o kan ye menso mi di so ma mfa nya akwadro do be kire me se menye bia me du fia me ye ne pepepe nura de be ma me okimo no me nom ne pepepe ndi me start ye nyame anim nie me nura de ma obi koba obeka asam foforo so me start ye no da na me start ye no a ma hunu hwi biem ekopem se me start afidie no so kra no enti me ye na efe na me suro enti me frɛ doctor no bisa na sei na ekɔ no se an me de enema na wa kire me nyina me hwɛ se me di so ebeboa me bisa nye nipa nyina na dana obegi treatment na ohun bibia nye nipa nyina enti ade bia wa kire me se me fa ahode ne eni de na me nye enti me hya ase no na eden pa na so Erade ye madom ma de omo kire me na me di so no nso no eboa me pa bi se wudidi yie wonum nsuo yie wonum nro yie na wa ye dan wa ma wani age se wo benya ayaresa se wo de to wakoma so sa se wo benya ayaresa bi se wo ye dan a ade na nya aba enti no obi wo ho a odi ne ho yaw obi wo ho odi ne ho yaw bibi kakra ye na ontumi ndi ne tirim ohunte sana eba sana se ye yire ye ho doctors ne de obeka kire udi so boa no a ade ne so be ye pepepe na wa ndi so ambo no ya akokimo ya mo waduro enema nyina bo ye den kimo hokora no enye yizi sika obetua na nya agora sana wakọ afidie so ne ye de aduro ma wana akotogu a so on the doctor ndo wa ye na afamu de awie enti nyame so kire ni tumi pa ma de omo ye me so me de ani eden ne ahodin ta kire ema nyame ye madom pa nyame ye madom enti me kwa de ombe bisam bia de ekoso bia no na maka ti doctor panyin na ohwe me no na ye no nwanwa me ba wo se bra no wa frem no ne me kọ no office os wo pa che se fida wo ba kumo no hwi biem bisa wo de ne ye dangerous pa fida wo bisa da kra wo ba ya me kọ hwe wo bibia no na me ankasa kura na me yam hyehye me so sala na wugina ho no ma hu se wugidie no ano odin ntime nso me ye din enti de wo kan eye me nwanwa pa nti o ma no me kwa kura ma mo hwehwe bibia na asem bia ni ho no se ene wa ya de wo no mu nro ni fa na me sempa chan me ye bibia kama edidie na ebia ya me ho nya me yintimi ntumi ni no se yere ho pa na nyame so hye ne ho anumunyam bebree se enye yare a eye nketenkete nya yare nketenkete timi de kakra me kan se eye se ye yere ye ho na test no time so a obia nkoye se sa de omo ka no em se enam be ma na de be ma sa na ade no na omo kire ni nyina sa na tie se nya sa wonam ho a na aye wo keke em se wo ne be ma oba ne be ma enam ene de sa na ema no eba enti me omo ka sa no na aye ma adwen bebre na me se na esa no ne kun mi kun na no me se o eno de o mu ntumi nkyere na bibia na me se o me kun ka ba bi no 18 years mu ani na me shampoo so me ne obi antana ho bepem ne jo mo se anu nti na ade ne kyeye na empie no omo se anu nti na kyeye na empie no se na me ne obi ye bibia nka be gi ne ho ntem nyame adom nyame so aye amene 5 years mu ani nyame aye adom ama me hu no hwe me ho so den kama nti me de nyame ase nti obi bia wo ha na wayere wo ho nyame de bibia nso no ye ne ye nkeka ye ho a yare de ya bisa amere ne de a enya ne den ni nyame de a den nti ye boa doctors ne ye jire ye ho ye si ye we ni wa ya bibia be ye fine bibia be ye fine me ye nya hoto that's it
member doctors and also where yeah me that's it to both of you, should we consider reframing cervical cancer as a woman's disease as it's generally perceived and present it more or less like a partner's situation that, you know, both men and women should be concerned about, should know about, should try to work at and towards, you know, trying to prevent it?
Thank you. So cervical cancer definitely is a woman's disease, but reframing it, like you rightly said, is extremely important because at the end of the day, it's a public health issue where both men and women need to collaborate and understand that prevention lies in the laps of both individuals.
Yes.
So how are we going about educating the men and empowering them to help them understand that the onus really lies on them, and knowing what HPV is, what cervical cancer is, how to prevent it, the education that they need to support their women in reducing the risk or the prevalence of the disease. So even in as much as cervical cancer is a woman's disease, at the end of the day, it takes a collaborative effort with both the men and the women for us to prevent it. So reframing is extremely important too.
Dr. Anita?
Yes, I agree with Vanessa on that. You see, we tend to think that it's a woman's disease because essentially it's a woman who goes to the hospital when they find the symptoms. But hey, don't forget that men also have HPV infection, which causes penile cancer. It could cause anal cancer. It could cause throat cancers as well. So just because they do not have a cervix to show doesn't mean they do not get cancer from HPV. We should, yes, reframe it from the public health standpoint, for everyone to know that it is a public health issue. Because if a woman gets the cervical cancer, let's say late stage cervical cancer, definitely this woman may not make it. And a woman dying in a family has a lot of other consequences as well. The same way a man dying of penile cancer also has consequences on the family. So we should reframe it, educate as much as possible. We shouldn't just concentrate on the woman because it's a sexually transmitted disease. Women cannot transmit sexually transmitted diseases to themselves. It takes men and women to transmit sexually transmitted diseases. So right from, let's say, primary school, or let's say, maybe primary school, we should start the education based from that side, so that by the time they grow, they are aware that there is something called HPV virus, which causes cervical cancer. In that way, it makes it easier to talk to them when they grow up. Because as of now, if you talk to men about it, it's still seen as a woman's disease because their education is not there generally. Most places, the men don't even go with the woman for screening.
Yeah.
The woman, sometimes, I don't want to use clandestine, but they walk to the center and then just get it done, whether it's positive or negative. Sometimes they don't even tell anyone what the results are. So we should also encourage couples services or men-friendly services so that when they go there as well, they are also educated on these bits about it. And like Vanessa kept on saying, it's a public health issue. We should continue with education. We should improve access to screening services. We should improve access to reproductive health care generally. In the houses, most of the time, the men are taking big decisions. And reproductive care or reproductive health services are not part of the decisions they take on that. So that also makes seeking healthcare concerning that aspect of the reproductive also a bit on the low side. So yes, I agree for the reframing and then the education bits.
That's an interesting segue to the next topic I wanted us to look at, which is what has to do with traditional beliefs, customs, and even the stigma that comes with this particular disease. One interesting thing, when I read the study that was done in Kumasi, most of the men who responded said they would support their women or their wives to screen, but they are just not comfortable with a male doctor doing the screening. Or others also said they would support their wives to screen, but they would want to know the cost involved. And like you said, they make most of the decisions in the house. So how do we marry the two where we can assure the men that even if it's a male gynecologist who's doing this, he's doing his job, where we can assuage the cultural beliefs where they feel like they're being emasculated by, having their women being screened by a male doctor when they go for this screening. Dr. Say, okay.
So the thing about culture is not static, it's not stagnant. And culture changes with information and knowledge. So that's where education, I keep hammering on education because I, for one, I'm a firm believer of when it comes to your health, ignorance is not bliss. Because the more you know, the more you're empowered to seek the right support, to seek the right preventive methods to help you live the best quality life that you can give to yourself and to the community as a whole. Yeah. So the more we educate, especially shifting the narrative of certain stereotypes, definitely men are more protective in terms of when their women have to go for maybe a routine visit with a gynecologist and they get in there and it's a man that has to do the screening. We have to also encourage the use of chaperones where even if the attending doctor is male, the presence of a chaperone should be very much enforced. So a female colleague or a female health worker or even someone that is female has to be present before the examination or the screening is done. So we have to just continue to educate the men on why it's important for certain steps to be taken, and even the women also. Women are also naturally protective of their bodies. We're looking at past histories of maybe trauma or having certain ideas as to why they wouldn't want a man to touch them. So the education is not just focused on the men, but also focused on the women to help them be comfortable with screening methods, providing them supportive measures such as chaperones, or even taking them through the procedure. There are certain places where maybe the procedure is not thoroughly explained to the person that is going to experience it. A simple, this is what I'm going to do for you, is going to involve me putting a speculum, it's a device that we use to visualize the cervix, putting a speculum in your vagina so that I can see the cervix and then assess it properly. Show the lady what the speculum looks like, reassure her it's not a painful procedure, but it's discomforting. Speak to her, talk her through the process. And in doing so, it not only calms her nerves, but it also enables her to even want to go ahead with the screening procedure. Educating them also on the vaccination It's very important. The young girls, the young boys, starting that education early would really help in preventing the HPV, the spread of the HPV. And in as much as the focus is basically cervical cancer, we've learned today that the HPV virus has different subtypes.
Yeah.
It's only 2. There's over 100 subtypes of the HPV, but it's only 2 out of those 100 that actually causes cervical cancer. And like Dr. Nita rightly mentioned, the different subtypes of the HPV virus also causes other types of cancers. Naturally, the HPV virus, the body is able to eliminate it over time. And there are certain things that puts one at even more risk of developing a cancer, such as the cervical cancer. So education goes a long way to broaden the knowledge of these individuals, and it trickles down. So when you educate them, they learn something, and then they take it down, they're empowered, they feel they take ownership of their health, their reproductive system, and they're seeking ways of how to, live the best quality of life that they can give to themselves. I think the goal of basically living is to live life to the fullest, and you can't live life to the fullest or have a good quality life if your health is not the best. So any person who is well educated, well empowered, would definitely shift to wanting to do things that would give them the best healthcare possible. So we have to just educate as much as possible.
Yeah. And I guess then that also probably is, Dr. Nita, the response you may have for the question of stigma, because the men in the Kumasi study that I keep going to every now and then, some said, when they were asked what they thought caused cervical cancer, some said abortion, some said women who were promiscuous, or they said some women insert herbal stuff into their vaginas, and that they think causes cervical cancer. How do we address this?
So it still comes to education, because like you gave example of an abortion. When you have an abortion, we are taking the products of conception from the womb. It has, we'll pass through the cervix to get there, but it really has nothing to do with the cervix. Basically, all they are thinking about is if you tamper with what is in the vagina, then you are at risk of cervical cancer. We still need to educate at all levels, secondary school levels, university levels, work level, church, mosque, friends, hospitals, in order to empower people, in order to give knowledge as to the causes of cervical cancer, how it's spread, treatment options available, screening and vaccinations available, and then even with the treatment, what stage is treatable, what stage is not treatable. So giving all of these to the general public as often as possible, as much as possible, at any place we can find people available to educate, it all goes a long way to help. Because yes, today you know cervical cancer, tomorrow you know cervical cancer is spread this way, then probably a week or two later you know there are treatment options available. We have pre-treatments, precancerous treatments, and then we have the actual cancer treatments. So all of that, as we talk about it, the more we talk about it, the more we are educating people and making people aware that this is what is happening. We also need to improve access to reproductive health services. Generally, people don't visit the hospital or visit the gynecologist unless, one, they want to give birth, or they are about to get married, or they want to assess their how fertile they are. Let me put it like that. So those are or when they get pregnant. Those are the only times that people will voluntarily visit a gynecologist. So we should also encourage women to see even if it's once a year, it's okay. At least if you screen, let's say this year, and it is negative, you could screen in the next 3 to 5 years. At least if it's starting, we may be able to pick it up at that early stage and then do something about it. So it all still boils down to education, improve access to reproductive health care services, improve access to screening services, improve access to vaccinations, improve the number of people that have access to vaccinations, and then have treatment options available, especially when they have the precancerous lesions.
Okay.
Yes.
Thank you. For those who are joining us, I'd like to say that there's a QR code on your chair. You can scan for the menu and order. And QIC is generously taking the tab for what you're ordering tonight. So we want to just let you know that, and thank QIC also for the support. I want us to come to responsibility in a bit, and we will have question time so that if you have questions, you can throw it to the panel. But I'm just wondering, from Madam Mavis, okay, I don't know what the word stigma is in Chi. If someone can help me, that would be great. I'm just curious to find out if she faced any of the stigma, either be the ones I've mentioned or any type of stigma at all when she was diagnosed. Can someone help? Anibia, who faces stigma? Please. Chile. If she faced any, exactly, and how she dealt with it, yeah.
Doctors ne kache o se wenya yare no na nkrofo ma o fere ye nkrofo ma o ye ti se omo ma eye ti se na eye wa na wa ye na ma we ni ewu
payifo pra frame se omo ne mentwetwe nkomo a obi kwa ka tem se mensan ya den na me yesa ale mpese obi ehu se eden na me so se sabi eskra na aye me a mekwa koka ma me nua bi wo ho a enne nyina obi wo ho kro nim se yare bi wo ho a wo ho ojindi mi se nkofo bebre ka se enye no kore ebi omu nim nkofo o mawu omu nim nkofo a omu koye ye nso a nye sa na omu keka enti no tese me de na nha me mom obi bisa me ametumeka na dan na aya wi ase kokolebu ase wo da fidie so me sen ai nyame adom nyame aka obi akoma ma watue sika ma ye hwe me na ho de omo so omo ye kora enye yo na me so nyame nti me ma pen so de ebeye enti me ho to me aye nsem bebre obi ho hu me a na nani awu obi kora te se me ban kora boy cancer de me say be sane o yes e before nipa bi a ye guru nipa ho enti yare eyewa e mane hawo se yare bi sei obi ti a mane hawo obi nte ya mane hawo no ane wu nipadua na obeyere wo ho na wanya gidie no wayere wo ho asa yare no asa nsem bebre me say me sister bi kra me start na ade ne ba me chen so mbo me be san so ade mi ni bibi a me de misika beye cancer a wo kosa wo ye den a wo bewu na me mbo wo be sia se adwuma ne de me nye nansia no sere me so pa ma chew me ko ne ba bi wedding na me say obi a cancer ye na enche wo bewu no onko wo ba wedding me ni ahode am de be se adwuma na wo nurse fo ne de so omo frɛ wa aya wunya ahode ko na me say ye wo omo a omo na omo hwɛ me te se me ko enti enipa ankasa bibifo ankasa no ye wo problem pa wo yare bia ye betete wo saa nti wo na wo yare na ese wunya gidie se de wo ho bia wo nsuro nyame ebe boa wo ho beto nti enipa kasa bebre na so nyame de o na ye bibia.
Okay, Mama Mavis Medase, and if you thank you for the assist. Okay, so when we talk about responsibility or accountability, or as we are looking at today, should men be held accountable in this fight? What, for each of you, does accountability look like, if I can put it that way?
Okay, so when you hear that question, should men be held? Actually, since I put it on my status, I've had a number of people sending me messages that, what do you mean by accountable?
Okay.
It's as if are men responsible for causing cervical cancer? I think that's how they understand it. Okay. Yes. But the question actually is, should men be held accountable for, should I say, spreading cervical cancer? Because previous times, we are making women accountable, only women, forgetting that it is a sexually transmitted infection. So it takes two to cause that.
Yeah.
So the question we are actually asking is that, should we add men to education, or should we add men in the fight against cervical cancer? That's how the question actually means. And yes, I agree 100% that we should add men in the fight against cervical cancer because one, they are carriers of the HPV virus. That is the first thing that we all need to know. So long as men and women are continuing to have sexual intercourse, men will get infected, women will get infected. So we should not just limit the education, the treatment, the spread, in quotes, the blame to women only. We should add men. And the education bit, the vaccination bit should start from teenage. Now the government policy, it starts at 9 years.
To 14.
Yes, 9 to 14 for the vaccination. So right from the young age, they should be included in the fight against cervical cancer so that by the time they grow up, it becomes a collective effort. So that we are all helping to fight against cervical cancer. In the developed world, cervical cancer is at the bottom of female cancers. They have other cancers they deal with, but cervical cancer is at the bottom because why? They started screening and vaccination. So it is part of women health where every year or so you will be called for you to come for your pap screen or your HPV screen. So if you screen and it's screen negative, after 3-5 years, you screen again. At the young age, some countries vaccinate, some don't. But it's the screening bit that started pushing cervical cancer to the lower ends of female cancers. Yes, so in the same way, if it has been done and it has shown success elsewhere, I believe it can also be done in Ghana for us also to become successful so that it pushes cervical cancer down as the number of women causing cancer diseases in Ghana. So yes, I agree totally 100% that men should be, in quotes, held accountable.
Dr. Zia, what does that accountability look like to you?
Well, it's a tough one, isn't it?
Yeah.
So the first thing that comes to mind when you say accountable, it means blame. But accountability is not blame, it's ownership. And we need to understand that men play a role in the transmission of the HPV virus. And in that same vein, they need to be able to play a role, they need to be empowered, encouraged to play a role in prevention. So accountability is all about taking ownership. And once you are able to take ownership of something, it means you're looking for how to make it better. And in making it better, you're looking for how to prevent it. So how can men be encouraged or empowered in the prevention of cervical cancer? Encouraging their partners to screen, supporting emotionally and financially, getting their daughters and their sons screened, and even they themselves vaccinated, their daughters and their sons vaccinated. So accountability is not about apportioning blame and saying that men should be blamed for the transmission of the HPV, even though they are the carriers. But we need to shift that mindset from saying that I'm blaming you for the HPV virus being spread around. It's more like, I would like for you to take ownership. And in taking that ownership, I'll need you to be in support of preventing the disease. So these are some of the ways in which we can do that. So for me, if you ask what accountability is simply taking ownership.
Do we need policy, for instance, in this respect? Say, before young couples marry, the males should screen for HPV, and maybe after wedding, after marriage, or also live, men should accompany wives to screening or their gynae appointments. I mean, do we need any type of policy to drive this?
Making it policy might be a little dicey, might be a little difficult, but we can empower them. I'm using the word strategically. We have to empower them to make them feel that it's a public health emergency or an urgency where they need to be able to see themselves as co-players in the spread of the disease. So empowering the men so that they can understand what the disease is. We're not blaming them and saying that you're responsible, but how can we encourage them to support and further reduce or prevent the spread of HPV? So simply that policies might not be the way to go, even though it might sound very nice, because of course, once it's policy, you are to do it. It's almost like it's law.
Yeah.
So policy might not be the way to go, because that also comes with a lot of nuances that might drag over a couple of years. So looking at what can be done today to help prevent future generations from getting HPV or cervical cancer, what can be done today? Education, keeping the men in the loop of things, not apportioning blame, encouraging them to support their women, even for themselves, because HPV, it's a virus and it's lot of subtypes. So the education goes a long way.
Okay.
Yes. So I beg to differ a little, Vanessa.
On the policy issue?
Yes, on the policy bit. So there are some aspects of cervical cancer we can make a policy. Vaccination. Because we are trying to talk about prevention. And generally, as blacks, our health-seeking behavior is very poor.
Yep.
Most people will not go to the hospital unless they are sick. So I believe, and I'm speaking for myself.
Yeah, absolutely.
I believe that there are children that are coming up. There are lots of studies that have shown that prevention of cervical cancer is best or is better than cure. How are we going to prevent it? By screening, vaccination, early detection, education. So what can we control? Once you get the disease, late stage of the disease, that one there's nothing we can do about it. But what can we as a country control? Vaccination has been shown to prevent cervical cancer. Who are we vaccinating? People who do not have the infection or who have not been exposed to HPV virus. Who hasn't been exposed to HPV virus? People who are not sexually active or who have never been sexually active. Generally, who hasn't been sexually active? People who are, let's say if we are being generous, 9 years. Yes, I mean, we have all sorts of ages starting being sexually active, but let's say 9 years. So where are we going to get the 9 years from? Junior high school, and I think senior high school. So those ones, yes, we can start vaccinating them. Because, hey, if you don't vaccinate them, these are the same children who are going to grow up 13, 14, 15. They start having sex. And by the time they are 25, they have been exposed to so many types of HPV viruses, out of which we may possibly get 16 and 18. Because, like Vanessa said, we have over 100 subtypes. Even if they don't get cervical cancer, they can get vulvar cancer, they can get vaginal cancer, they can get several types of cancers caused by HPV. So I think that we should make it a policy where children between 9 and 14 years receive their vaccinations to prevent them from getting cervical cancer. It's not going to prevent them from having sex, but at least it's going to prevent them from having cervical cancer. Just as we rolled out the opt-out HIV screening test for pregnant women. Before, pregnant women just go to the hospital, get their antenatal screens, and come back without knowing whether they have HIV or not. But HIV is spread from mother to child. We call it prevention of mother-to-child treatment. Now there's a policy. Initially, I think it was opt-out. Now it's opt-in. I keep on mixing them up. Now you go, you are educated about it, you are told about HIV, you screen. If you are positive, you take the medication. If you are negative, you continue your antenatal. In that way, HIV transmission to children has been reduced drastically in this country. We have malaria. We have intermittent preventive treatment for malaria by giving the SP, which helps to prevent pregnant women from getting malaria. We have reduced the malaria infections. We have tetanus and all that. All of that came up because they were causing problems. And it was introduced as a policy in parts of the antenatal care. So I think it should be introduced as a policy in, let's say, adolescent health services.
Okay.
Yes, or in reproductive health care in their schools. So that as many children as possible receive this vaccination. And let me tell you this, in about, maybe now, we are thinking of costs. We are thinking, oh, we need to tackle malaria, we need to tackle HIV, we need to tackle breast cancer, because those ones are bigger and more money goes into that. But the ones we are avoiding are the ones that may end up to bite us in about 20 or 30 years to come. Cervical cancer is a very slow growing cancer. So as we are putting in the preventive measures now, we will not see it. But we realize that come next 20, 30 years, the infection rate or the disease will probably go down, and it will move from number 2 to, let's say, number 6, later on maybe number 10, later on number 20. But it takes time.
Yeah.
So I think, yes, it should be introduced as a policy.
Okay. So before we get to talk about the fund also, which is what I want us to look at next before we open the floor up for questions and comments, because today we are talking about accountability and men and their role in this fight, how do we make men become active allies, or maybe advocates, pick your choice of word, in this fight against cervical cancer? Because we've established that it is transmitted, they are the carriers and transmitted. And we're also thinking about the reframing of it being a shared responsibility as well. So as men, how do we become active allies, advocates in this particular fight?
Education. I mean, at the end of the day, it all boils down to that. The only way you can gain the support of individuals is simply to educate them. When it comes to health, you really cannot force anybody to do anything, and that's the difficulty with it. Except maybe it's a child and you feel there's a need for them, for you to intervene. So education is extremely important, and there's no two ways about it, and it's the only way to be able to have the men onboarded in the prevention of cervical cancer.
Okay. Dr. Anita?
Okay, so I would, in addition to that, I would, we should also encourage men or male-friendly clinics. Yes.
How do you mean?
So, I mean, in the context of reproductive health.
Okay.
Not just men going. So in the context of reproductive health, we have, I mean, it still comes down to education, I guess. Male-friendly clinics, as we encourage the female to come to the clinic, we encourage them to come with their male partners. So that when they come in, we are educating them, we talk to the men as well. And then we should also encourage reproductive health to discuss it in their homes as well, and encourage men financial supports, moral supports. Yes, I think basically, yeah, that's how we can get the men to, yeah.
Okay. And how about going on the appointments with their wives to see their gynaes? Is that a way to become an ally as well?
Yes. So should I say couple therapy or couple friendly clinics?
Couple
as well?
friendly, yeah.
Yes.
Okay.
Because now, in most, maybe let's say government hospitals, when the males come to antenatal with their wives, they are seen earlier than if the females come alone.
Pro tip.
Yes. So it encourages the male, especially when they want their wives to come home early.
Yeah.
It encourages them to come with them, because sometimes even when you give education, as information is being transmitted from one person to the other, it changes.
Yeah.
So they are also encouraged to come. So we could encourage couple health friendly services as well.
Ma Mavis, ebana memana say na wait, let me reframe the question. Osha ye memano den esese ye na ye de boa ema se bano say ye quantia cancer way. I hope I made sense with the question. Yeah, okay. If it will be our man memano.
Say kakra me kan say yes say ye nyina ye boa ye ho say yam boa ye ho a enye yi say em say enye oba no nko ana em say ode yare na ye den nti say ye nyina ye boa ye ho na ye nhwehwemu asem a ye kan obi wo ho a me kai say ye call yi na man bi one na yire how ana woman no esuro ni said de ayamhyehyɛ nko ama woman na ye no me hu me yam hye me zafia na me nso me start na how am I no agye yare no kra yale no wo gina kra na yare no kra no wo skra wo nsa nsuro biem enti ka me kan say ye ma o say ye ma ye test na me ma de no na minnim so omo so san na ye so omo ya me say wo ho a wo be hu say wo be kwako hu doctor ana bibi ni a na ono so waboa wo if say de ma na ye de ye no me minnim me ma no so say de etie enti no o mo amwo ma ana wo yira ma ne nko no akɔhwɛ wo ba ma no so no bi mi de minim sɛdeɛ mo de na ebesi faafa ti wo doctor nso wo hɔ ano akɔhwɛ wo ho kakra zenya bi before de ne ma saa yɛ nyaade nipa bako na ɛyɛ adeɛ wɔ saa adeɛ no ho wo akɔhwɛ wo na wo ma wo hɔ a tam so ano de wo mo kɔ no akɔhwɛ wo ma yɛ saa test ni nyinaa ma wo nyinaa ɛma wo dan yi no akɔhwɛ obi wɔ hɔ a ne wiase ɔba yi ɔnkɔhwɛ te sɛ me die yi bi hospital onko onye hwe trade na aye ne kese bi se wa anya sa nurse for no kama meti ase se eba ahyase no a omutumi ye hu bibi doctors ne kire me se ba ahyase no omutumi ye hu bibi na se ekọ animu a omo ye hu hwe a enye ye enti e mema ne de me nheda nimu ho ayi bebre na so de me kan se ye nyina test ya na ye nyina ebe ye na ye hu ye doctors na anytime bi o ma boa yen na bibi ikoso a na me say o ma kire de ebe ya ye nso ye benya ahoto ebu o ho a na yirinya problem say ya na atiatia ne niema bi basa ohun sada man ne ye no menya rehyem bi nya kokuduro bi ma na sada na ma me ne ye mehwe ma me na nka me ko ofie nka me mba bi ze na menya suro bi na sada papa na gye yare na yale mama me no afi me gina ho na me amasan nya ho odin bi say na afi na me wra asan ho senka me so me kunu wo ho a nka ono so aye den nka wo boa me say ya enti no kakra me kan say ye nyina ya yenkɔhwehwɛ ye ho kanka ma de o problem pa de ni man say ya sori a ya fa ye bag a ye kɔ adwuma se saa de ne ma hu hia ye say yare bia se nyame wa fa doctors fa ma nka ye nim de ebe ye yare bia eso mu na edu akira wo ye wo ho hwie nye ye wudi agora wo be wu seconds enye yare eye agudie yare kora yare ebefia na efia bo wuni ska kese a de besi mi say ye madam you no mo hwe me a me kwita nkwala 6 me ana me koba da bia o papa ka ba bi dada me ana me koba se ska kese we me ko fa no he me nya nti de be ya ne se makwa akɔhwe fie na de be ye me na ye me ohun nti de me kan se ye nyina me ye ntana se wo ho a nipa de 6 months 1 year na wakɔ wo doctor no wa show ene nyame adom me doctors for bebre ya manyonkofo me wo ha na say yo na me nua ba aya na wa ba na ja ya hwehwehwe me na me sen me ta mo so na me kɔ unye obi obekrokro no watam wasika mu a na wa wakeka ho bi se ba nko na wo bebre e ba nko na wo bebre ya le bone pa me nim pose nne nka me gina ho sei nti ana ye ma hoho a dan se nkofo bi frɛ me baabi obe kɔkasa fa mpanfo wo nyina ani gieye biso obi oho ye ne fere so obe bie na no kora na waka wo yesa na wudi wunyonko bɔne biso obi oho nso a wonte ebi kora wonim sɛ yare bi a ye hu sa nti no ye nyina ye bɛboaboa ye ho na ya hwede nyame bɛyɛ emma o mema tam so a ye nyina yenkoye test ni bi yenkɔhwɛ ye ba bia bibi kɔso a mema so wo mu problem pa bibi kɔso na doctor ehu no waka kyerɛ wo ntem ze ye kɛse bia na woni ska sɛ de wo de bɛkɔ kɛse mu ama ya boa wo.
Okay.
Remember, doctors, I was about to open the floor, but hearing her reiterate, for instance, the cost of having gone through chemo, for instance, and what the anecdote she made about, for instance, like if you go and pay all this money and you decide to not take the medicine, that's probably on you. I was just wondering, just as we think about this and encourage women also to screen, what's the average cost, for instance, of treating this cancer? Could you share some insight?
was going to leave that for Dr. Nita to answer since she is the obstetrician gynecologist, but I'll just chip in a little bit before she can dovetail into it. So the average cost for treatment would usually be dependent on the stage.
Okay.
So there's different stages of the cancer, and that would relatively be influenced, the cost will be influenced by the staging of the cancer and also the overall well-being of the patient. Because besides the screening for the HPV virus, there are other tests that would need to be done, follow-up tests, specialist consultation, surgical intervention, chemo, radiotherapy. So depending on the staging of the cancer and the need of the individual patient, that would influence the cost associated.
Okay.
Okay, so you want me to put numbers to it?
If you have the numbers, I will appreciate it.
Okay, so currently the screening for the pap smear plus the HPV is February is pap smear cervical cancer awareness. No, January is cervical cancer awareness month. But
yes.
Kolebu is having a cervical cancer screening tests at reduced prices. So what I can say for now is the screening for HPV and PAP together is $290. So after February, I'm guessing it will go back to the original price, which I think is $350 or so.
Okay.
But when you get the cervical cancer, depending on the stage and depending on what has to be done for you, like Vanessa rightly said, if you have a precancerous lesion, it would probably be just a hysterectomy we're going to do for you, which would come at relatively, let's say, 3,000 to 5,000. If it's in a government facility,
okay,
maybe 3 to 6,000. I don't know the numbers of head. If you have stage 2, you would need labs, you need consultations, you need scans, you may need a CT scan. Then, depending on which level of stage 2, you may need a surgery or not, or adjuvant stuff. So the surgery has a cost, like I'm saying, between maybe 3,000 to 8,000. Then you have your chemotherapy, you have your radiotherapy. Chemo depends on the drug they are going to use for you. Recently, I heard one of the chemo drugs is 15,000 cedis.
Wow.
And if you're going to have like 6,
one cycle.
One cycle, yes, one cycle. So if you're going to have like 6 cycles of that, that would cost 15,000 times 6. Then if you are, say, stage 3, stage 4, where it's unoperable, but we could use chemo and radiotherapy, not to cure you, but to improve your quality of life. That would also have another cost. That would be maybe more sessions. So that would probably run into hundreds of thousands of CDs, 300, 500, I don't know.
Yeah.
Then if you have the latter stage, stage 4 something, all the stages have A, B, C, A, B, C. So if it's stage 4 latter parts, that one it's we call it palliative care. So we have it's like end of life counseling and stuff like that. You still need to be comfortable. So you would go through consultations, blood transfusions, medications, hospital visits. Sometimes we may need to debulk some of the mass so that you could maybe sit better or improve your quality of life a bit. So all of that come at several costs. That's why we keep on hammering on prevention.
Absolutely.
Because you are thinking that, $350 is expensive. But that's $350 every 3 to 5 years. The vaccine is, I think it's about probably 2,500 or somewhere around 2,000 per shot. And you take 3 shots. It's like the hepatitis B vaccination. You take 1, then 1 month later, then 6 months later. So even if it's 5,000 per shot, that's too much. Let's say 2,000 per shot times 3 is 6,000. Compared to if you leave yourself, no screening, be carefree, and in about 15 years, you realize you have, say, stage 2. The labs, the clinic visits, the scans, the CT scans, your drugs, your surgery, your medication, all of that combined is going to be way more than the preventive care. And on top of that, it's going to really reduce your quality of life. So those are the numbers of head I can think about.
Okay.
So yes, prevention is still better.
Yeah.
than getting
Absolutely,
it.
because 350 CDs compared to 15,000 times 6 is, yeah, it seems like
And
it.
I mean, between, oh, it's okay, today's 25th, we just have 3 days. Between now and ending of February, if anybody wants to screen our Collabo, it's 290 CDs.
290.
After February, it goes back up to 350.
Okay. So we'll open the floor now. If you have any questions or comments you'd want to make, we can take them now. And then we'll come back and talk about the fund before we wrap up. So we have a microphone available. Okay.
Helen, so find out, since we indicate the men who carry the
virus,
yes, the anti-set, do the men also go through screening for them to know if they have it or prevent it?
Okay, so correction. We're not saying the men are the ones that carry the virus. Both male and females carry the virus because both can get infected. But because we deem it as a woman's disease, it's assumed that men don't get HPV infection. They do get HPV infection. Just that most people don't, because they don't have a cancer, they don't have a cervix, they don't have cervical cancer, but they have other forms of cancer caused by HPV. So they can also be screened. Yes, and it's usually a swab. So just like we swab the women, we swab the men also, and we swab the penis. Yeah.
So I'll just add on to that. So routine screening for HPV in men is usually not recommended. It's only done in special cases, such as men having sex with men, and then those who present with genital warts or having any form of signs and symptoms that may indicate infection with HPV. There is no alternative for the pap smear for the men, and that's why routine screening for HPV in men is not recommended unless it's really necessary. And men also, just as women, naturally they tend to clear the virus from the system over time.
There's a hand here. And then
Thank you. I beg to differ with Nita's point about men not being the cause. Because for a woman to get HPV, it has to be introduced into her system. Am I right? Yes.
Yeah,
and it has to be introduced into her system. And that introduction is a cause and effect equation. So when we talk about responsibility, and we all danced around it because we don't want to lay blame, but the responsibility of infecting women, or men for that matter, lies on the man. So responsibility, and for men, once you say anything is going to happen to their penis, they are definitely going to jump up and pay attention. So I actually learned something, that they can get penile cancer from HPV. So if we want to link responsibility to self-care, I think hammering on that should at least let men be more aware of the fact that if they do not test for HPV, they are going to end up with penile cancer. I tell you, everyone is going to run to the hospital to test. But we can be very nice about it, but there's a cause and effect.
Stevia, we are trying to encourage the men to support. So we cannot lay blame. It's a shared responsibility. It takes a man and a woman to have sex. What if that man who started spreading it got it from a woman? You cannot say. You really can't say who started spreading it. Just that's why we are trying to encourage it. Exactly, chicken and egg. That's why we are encouraging a shared care, shared responsibility. So encourage our men to support us as much as possible, so that we don't end up having to fight this battle alone. Because believe you me, in certain homes, if the man doesn't give the go-ahead, the woman cannot go. to even screen or even just go for normal checkup. So we are trying to encourage them that yes, women are the ones who come out having the cervical cancer, but it takes two. So why don't we both try to solve the situation rather than laying blame that, oh, it's a man who caused it, oh, it's a woman. It doesn't really solve anything. So that's why we are trying to encourage our men to still support us and to bear in mind that, yes, they also can get infected.
Yeah, okay, we have a question at the back.
Yeah, all right, thank you. So mine is on symptoms, right? So just like with breast cancer, when you feel a lump in your breast, it may not necessarily mean it's breast cancer, but then you ask to check, right? What are the symptoms for cervical cancer?
So the first one is that a lot of people are asymptomatic with the HPV infection, not cervical cancer, with the HPV infection. And it has a very long incubation period, 10 years, 15 years, 20 years. Maybe as short as 5 to 8 years, yeah. But majority of people, 10, 15 years. So you can carry this virus for that long and you would not know, the woman would not know. When they start showing symptoms, that time they probably might have gotten the cancer. So commonest one is an abnormal vaginal discharge, abnormal offensive vaginal discharge. And believe you me, if I enter this room and I smell it, I know that there's somebody in this room with cervical cancer. It is so characteristic of that type of cervical cancer. So when they have that abnormal vaginal discharge, usually they call it insuffin. It's mixture of blood with old blood with normal vaginal secretions. That's one. Then they also have abnormal vaginal bleeding, or sometimes bleeding immediately after sex. Sometimes they may have urinary tract infection symptoms, blood in their urine, difficulty urinating, painful urinating, and then sometimes they may complain of big clots at odd times in their cycle, not related to their menses. So those are the things that they may sometimes abdominal pain, weight loss, nausea, back pain, depending on where it has spread to, back pain. Yeah, those are the commonest things they can come with.
Okay, so
yes, and pain during sex. Yes.
Okay. You also said when someone has that smell, you can easily tell.
Yes.
Can you smell it now in the room?
No.
Thank you.
It's not in this room.
Okay. We have a question here.
I just want to add on a little bit to that. So, in as much as these are the signs and symptoms of cervical cancer, it does not mean that when you're having intermenstrual bleeding or pain during sexual contact or abnormal uterine bleeding, you have cervical cancer. That's why we encourage you to visit your healthcare provider, a professional who would assess you, and based on the diagnosis, management, and then the plan of action, would know what exactly we're treating. So it doesn't mean that when someone is complaining that they are having pain after sexual intercourse, they have cervical cancer, or that if maybe between months they have some bleeding, they have cervical cancer, or if they have an offensive smelling discharge, they have cervical cancer. Okay?
Okay. Yes.
Okay, thank you. Just a few comments. In this era where we have different sexual orientations, okay, I'm saying this because of what she said, that the men are the major carriers. Yes, probably. But in this era where we have different sexual orientations, a woman can still spread it to a woman. A man can spread it to a man.
An infected woman?
Yes, an infected woman.
Okay.
Yes. So, because of skin-to-skin contact, using other devices and all that can be spread. So, we should also consider that. Then, how can men contribute in preventing cervical cancer? I have a few points. Education, as said by our panelists, very important. And where should you start from? You should start from primary school. And we forget that as men are, in quotes, the carriers of HPV, what about vaccinating the boys? We've not spoken about it. We don't even speak about it. So it's also very important. Vaccinating the adolescent males after age 9, very, very important. And also for the men. I think we don't have any policy in Ghana about vaccination for the men, HPV vaccination. But if prevention will start, that's where it should start from, also the men.
And the policy is on males and females.
The government, I think the free government one they announced was targeting females.
Females.
I remember female.
So
I
it's
don't
not
remember
targeting
them
the men.
mentioning
Yes.
males.
There was one that was introduced some years back. That one was both males and female. The
Yes.
one that was Cape Coast, Northing, and another region I forgot. That was both males and females.
Yes, but the recent one, I mean, they're just targeting the females. Well, I don't know whether they have plans to expand it. I don't know, probably. Also, the HPV, or let me put it this way, the commonest cancers in men, top 10, you won't find any caused by HPV. So that's why it's not spoken about. By women in Ghana, top 2, the second most common. But for men, maybe liver cancer and all those things. Top 10, you find penile cancer or inner cancer or throat cancer. So that's why it's not spoken about. But if we make it a point to be educating ourselves, including men, and the need to help our women, and when we are going for the screening, join them, and all that, it also helps in preventing and managing this issue that is at hand. Thank you.
Right. Thank you too. Any comments from any of you before? Okay, there's a hand here. Okay, yeah, and then we'll.
Thank you. I've got a question on the accountability part for men. Do you think, and it's probably linked to the policy part, do you think maybe hospitals should also be held accountable to educating men? And on the policy part, maybe it should be linked to, I don't know, they have a quota of the number of men that have been screened in a year, because clearly men don't know about it. So don't you think maybe the accountability starts from the hospital? I don't know, just a question.
Okay, thank Dr. Anita.
Okay, so it would start from a hospital if people were going to the hospital, but they're not going.
I mean, it could start from the men that you do see.
Pardon?
I said it can start from the men that you do see.
We do see, yes.
Yes.
Yes, so I can speak for my hospital. I work in Kolebu, and I know that when the men bring their wives or girlfriends to the reproductive care or reproductive health center, they talk to them. So it helps them, it enlightens them. When the men come for antenatal services, they talk to them. As part of antenatal care, they have these talks every day about, there are lots of topics in the antenatal book. So they have that talks on those days. And as part of all the topics, they talk about that as well. So those that come to the hospital, we can capture them there. But those that don't come there, then we could expand our education to churches, to schools, to banks, to wherever, mosques, like gathering like this, social media. Yes, so those ones we could spread to that. But those that come to clinic, yes, we are accountable to do that, yeah.
Absolutely, I agree, because your question on should men become advocates, advocacy comes from communities being built. And communities need to be built by people who already know about the situation. Men cannot build a community if they don't know, if that makes sense. So I think it really starts from the hospitals and probably the government. Yeah.
All right, thank you. And there was a hand at the back, I think. Yeah, okay.
Okay, thank you. It has been established that having multiple sexual partners is one behavior that increases one risk of catching the virus. But apart from that, are there other circumstances that put, well, women at a high, or let me say higher risk of contracting the virus? Thank you.
Okay.
So when it comes to that aspect, we are looking more at the risk factors associated with cervical cancer. So one of it is early childbirth or early pregnancy or multiple pregnancy. So usually with a younger population of girls or women, their cervix is still developing. And cervical cancer, usually when the cervix is in that developmental stage, it means it's changing in forms multiple times. And that creates a conducive environment for the HPV to thrive. So with multiple pregnancies also, especially vaginal pregnancies, there's that expansion and contraction of the cervix. And when that happens, there's always the change in the nature or the structure of the cervix. And that also creates a conducive environment for the HPV to thrive. Yes, multiple sexual partners can also increase a woman's risk of getting HPV virus. And then also contraception use. So hormones tend to create or feed, these cancer cells tend to feed off hormones. And if you're using certain hormonal contraception, it tends to increase your likelihood or your risk of getting cervical cancer. The other thing is also smoking. So these chemicals tend to sit right on the cervix, and it also creates that conducive environment for the HPV to thrive and then replicate and then becoming cervical cancer.
Okay, thank you. Okay, yeah, go ahead.
Okay, so I wanted to speak a bit about the sexual partners, multiple sexual partners. So we have two ways of seeing that. A woman who has multiple sexual partners and a woman whose partner has multiple sexual partners. They are two different scenarios. So either ways, both get a higher risk of being exposed to the cervical cancer virus, the HPV virus. So in that way, let's say if you're having two sexual partners just two sexual partners, you would have a lower risk compared to somebody who has 5, because then they go around picking different types of HPV viruses, and they come to you and they deposit the different types. If you have 2, you can have HPV 33, HPV 52. If you have 10, you can have 16, 18, 33, 51, 52, all those types happening. And that would rather increase your chance of getting cervical cancer. The other risks that Vanessa talked about just tend to, they don't cause it. They just increase the risk of getting that. Because if you don't take care, people will start saying, oh, then I'm not going to use hormonal contraceptives again. Yeah. Oh, I'm not going to have vaginal delivery again. We are all going to have cesarean section, and that's going to cause a big problem for all of us. So yes, they just increase your risk of getting cervical cancer. It doesn't mean that if you have multiple vaginal births, you're going to have cervical cancer. Yeah. Or if you have multiple hormonal contraception, you're going to get cervical cancer. It just increases that risk if you are already at risk of cervical cancer. Okay. Or of HPV infection. Let me put it like that.
So, okay, you have a follow-up? Okay.
So from your submission, you mentioned some types of HPV virus.
Oh, there are over 100.
HP virus.
HP virus, yes.
So I got the impression that if you have about 1 or 2, it's fine.
No. if that one is HPV 16, your risk is higher than somebody who has, let's say, 51. Do you get it? The ones that are causing the cervical cancer is HPV 16 and 18. They have the highest risk of causing cervical cancer. There are other types, like we said, over 100. They cause other types of cancers, not cervical cancer. Some don't even cause cancer, they just cause cervicitis and stuff. But those ones don't cause cervical cancer. But if you have that one, and it's either 16 or 18, then the chances that you would get cervical cancer later on in life is way higher than somebody who had, say, 33.
Okay.
Yes.
So I was going to say we have about 5 minutes left. So let's try and workshop the idea for the fund that we're trying to set up, because we want to help women get free or at least subsidized screening, which currently stands at about 350 cities. And let's workshop it. Which I want to find out from you, for instance, what would be I know that would be the ideal and then the best possibly way to go about it. Which will be the best way to go about it? I think that's the one I want to know. But if you have an ideal suggestion also, we'll take. Because we want to not only just help the women screen, but as part of this conversation to make preventive care become something of a forefront, something women have to think about, especially when it comes to screening for cervical cancer or the HPV virus that causes it. Or we can take from the audience if they have, and then we'll come back this way if anyone has ideas for the fund that we're trying to set up. What should the nature, for instance, be? Should it be an open one? Should we partner with multiple organizations or just one organization coming in? Or should we make it a call where, you know, like we launch a campaign and you contribute towards it? You know, there are multiple ways to probably go about it. Yes, debate house. Yes.
Well, I guess it has to be from donations. If debate house is the one going to have that. Outreaches, corporate societies, insurance companies. I think, but if it's debate house, I think those, and then individual contributions.
Okay.
Yeah.
Yes. Anyone else? Yes, there's a hand.
So basically, I think you can just reach out to organizations that are interested in partnering with Debate House in this regard, and I'm offering my organization as one of them, so we can start with us. Thank you.
Thank you very much. I'll see you. Do you mind telling us your organization, or do you want us to do it afterwards?
No, Lisa Freak.
Lisa Freak.
Lisa Freak. Yes.
Thank you. Yes. Okay.
Maybe you could do a crowdfunding type of subscription from organizations and individuals, and then every month it goes to a number of people to get screening or to help individuals, and like it's transparent so everybody can see where it's going every single month.
And how do we pick the people, for instance, who
They could vote.
get to benefit?
The subscribers could vote.
Okay.
And I was also thinking that for subsidized fee, the larger the numbers, the better, because once you're able to get, I mean, it's the same reagents they're going to use to test, and usually when the numbers are fewer, the labs tend to make more losses. Okay. So if we are going to, let's say, subsidize for a group of people, we could speak to them, let's say Metropolis or any of the Pathology Without Borders. We speak to them, or if you're charging, let's say, $250 per screen, what if we bring 200 people? Can you charge us, let's say, 100 per person?
Yeah. Okay.
That one too would help us to screen a lot more people.
Yeah. Okay. Yes. Okay. So I guess we'll be wrapping up then.
We've forgotten government.
Oh, yeah.
We could speak to some government institution, the Women and Child. What's the name of that?
Gender Ministry.
Gender, yes.
Yeah.
Gender Ministry. Yeah. Maybe they could help.
And the Health Ministry. Probably as well.
Mahama Cares, yes. That one too is there. So maybe they could also support with some funds. Generally, reproductive health services don't get too much money. Yes, the money tends to go to breast cancer, HIV, malaria, tuberculosis, rather than cervical cancer. So maybe we could get something not too big, but we could use something. Yeah.
As we say, kitwe biensa.
Yeah, kitwe biensa.
Yeah, whatever comes, we can start with. Okay, so I guess I'll give you the final words. We'll start with Dr. Aseye, and then to Ma Mavis, and we'll end with you. We'll start reverse order. So, final words on today's conversation.
Well, my final words would be cervical cancer is not a death sentence. Early detection, just with all other or most cancers, saves lives. So educate yourself to be empowered so that you can play an active role in the prevention of cervical cancer.
Thank you. Ma Mavis, a photo kitwe be best at 30 seconds. I'll be Maya.
Mepacho kakra meka kire me nuanom ne me sisters ne mema I'm say, ye nipa yi deɛ yare deɛ ye dan a ye be yare nti kakra metumi aka ne sɛ ɛba ye ntena ho mpo ma ne mba nsa ye sɛ tam bi wɔ hɔ a nipa deɛ sɛ wokɔ hospital na wonya wo doctor na ɔhwɛ wo apɔmuden bi nkɔ yi a ɔbɛkyerɛ wo deɛ wobɛyɛ na wahu deɛ wobɛyɛ na sɛ wobɛtena hɔ a deɛ a ɛne ɛmboa kakra mɛka no no ɛnyɛ sika he bia ɛnyɛ dodo bia na ɔmo gye ansa na yɛbɛyɛ we ama yɛbɛhwɛ wo obi bia ma ɛnyɛ sika he bia kakra bi utumi yɛ yi ano so ano akɔyɛ 6 months bi ano akɔyɛ asɛm bia ni hɔ a wokɔ wo baa bi wonka wasɛm nkyerɛ obi hɔ a woka wasɛm kyerɛ na oh I say yo ntinka mekɔ oh wo de jai menkɔ wo nam hɔ dan na yɛ wo enipa kasa nti wo a wode wo ho no wa na ɛsɛ wo bɔ wo ho ba na hwɛ wo ho so yi kakra metumi aka mabaawa ne mrantie mesra mu yare wo nam hɔ sɛ deɛ wo hu sɛ me kwa minim kra sɛ yare akɛse sa akra wo bisɛ me deɛ minim an sɛ ade akye me mansie nti me ho kyerɛ me nti ɛsɛ me ma mani yɛ den na me boa nkwala no mani ba me ho so no na sɛ me sɛ yare a yɛ ka akɛse sɛ wɔ me na ho pɛɛ sɛ ni ba bia sɛ nyɛ nyame adawro ma kasa mre nka me hye fam nka nkwala na medwe wo mo ho a me sɔre kora me nya sika me fa bi nkɔyɛ me ho hwee no nka me ni hɔ ka me gya wo mo hɔ di kakra mɛka ne sɛ aya yɛnhwɛ yɛ ho so yie test na ɔmo ka no mo me nkɔyɛ hospital ba bia wo kɔ a ɔmbɛhwɛ wo ɔmbɛhwɛ wo bisɛ yare bebree na we yɛ nipadua mu a aya yɛhu saa cancer we yare bi a ɛyɛ wa ɛkyɛ wo ho paa ansa na bepie ama wahu ɛno nyinaa chikura wa ankɔ hospital a wunnim sɛ bi ɛno kora na ɛyɛ wo nti ɛno nti na nyame ama yɛ nimdi ama ɛgya yɛnya yɛnuanom ne yɛ mma ɛne yɛ papa nom doctors ne yɛnya abotre de ɔmbɛkyerɛ yɛn so ne yɛde obuo ne ahobraseɛ ne yɛde agye ne yɛayɛ na nkunimdi aba na yɛ nyinaa yɛni agye nti kakra me so metumi aka kyerɛ me nuanom.
Okay.
Amen.
Yeah, that's it. Dr. Anita.
Okay, so I would also say that early detection saves lives. And just as the topic for our discussion today, men should be encouraged in their fight against cervical cancer because it is a shared responsibility. It's not a woman's disease anymore. It's a shared responsibility. So as much as possible, our men should be encouraged, should be empowered. They should be included in this fight against cervical cancer. And I believe in about 20, 30 years' time, cervical cancer will be one of the least common causes and common cancers in Ghana.
Well, thank you very much, Dr. Nita Asamoah Nujima. She's a specialist obstetrician gynecologist at the Kolebu Teaching Hospital. Next to her is Madame Mavis Enima. She's a cervical cancer survivor who was diagnosed 5 years ago. And next, on the far end of the panel is Dr. Vanessa Ase Atipui, a medical officer at West African Rescue Association, and she's also the icon for QIC Insurance's Go Girl policy. Thank you all so much for joining us tonight, and for those of you who are watching online as well. We'll wrap up this conversations on cervical cancer on 8th March. Where we'll be looking at, we've heard our mother, for instance, Ma Mavis, talk about God's divine intervention a lot. So we'll look at how culture, tradition, religion, the interplay of all those versus, we've already also established that as Ghanaians and as black people, we don't do preventive screening that much for everything else, not just cervical cancer. So how do these traditional religious beliefs impact how we seek preventive health? So please help us spread the word. On 8th March, we'll be back here again with another panel, and we'll be wrapping up our series, which has been in partnership with Quality Insurance Company Limited. We thank you all so much. Have a good night, and hopefully we'll see all of you again on 8th March. Thank you.